One of the real problems with thyroid eye disease is that it's so diverse, so heterogeneous amongst patients. Some patients get it very young, and I've had some patients get it when they're 80. Typically, patients will get it in middle age, in the 40s, 50s, 60s. But, look, it can occur at any time. It is usually preceded by Graves' disease, an autoimmune attack on the thyroid. And that has implications because there's two receptors that the immune system attacks. One is on the thyroid, and one is primarily on the eyes. And when the immune system attacks the eyes, it causes inflammation and tissue expansion. And for some patients, they just get bulgy eyes and not a lot of inflammation. And in other patients, they get tons of inflammation and maybe not as much bulging, or they can get double vision. So, really, anything that causes tissue expansion, bulging, inflammation around the eyes with Graves' disease has to really be thought of and investigated for thyroid eye disease. Yeah, the patient journey to diagnosis can often be rather complicated because, as you can imagine, patients are often being treated or having symptoms due to thyroid malfunction. And that's, really difficult for them to deal with because they might be hyperthyroid or their thyroid is too active or low. But then they start to get eye problems, and it's often misdiagnosed as allergies or as other things like that are non-specific. And so they'll often go from provider to provider looking for care and trying to find care before they really get a diagnosis. And this is on average has been about over a year before they sometimes can get diagnosed with thyroid eye disease. The biggest clue is often if someone has a thyroid abnormality, and that can be both Graves' disease or Hashimoto's, and then add in any kind of eye difficulty, whether that be, redness that doesn't go away, bulging, or a little bit of a stare, something like that. That combination is a big tip off. But it's very common for patients to say, my eyes look different. I have this stare. I have this chronic inflammation. And so that really of itself is a huge tip off that, hey, maybe this isn't allergy. It's been around for a month. It's not going away. Then you really have to dive a little bit deeper. And you can dive a little bit deeper just by doing some thyroid testing, and some other, a little bit of a history of patients and really kind of get to that diagnosis fairly quickly.